Thank you so much for being with us this afternoon and this evening for our Health, Human Services, and our Equity Committee budget hearing. I'm going to go ahead and get us started on time. I know we are expecting Councilmember Rush. She's going to be a little bit late, but I think we all want to get out of here in a timely fashion. So, once again, I want to especially give a thanks to our departments that are here with us today. Deputy Director Hannah Jones, Executive Director Danielle Tong, and Assistant Health Commissioner Anita Clark for being here today, as well as Monica Sarazuela, who's joining us from the Adam Board, and Michael Corey from the Human Services Chamber, who will be joining us virtually. Today's hearing will be an overview of our budget for our Health, Human Services, and Equity Committee. We will have presentations from the departments within the city that are under our scope, as well as several of our external partners, and I know several others who came to testify today. We will also learn more a little bit about our city's investments in our alternate crisis response programs from Columbus Public Health, from our Department of Public Safety. Oh, and yes, thank you as well for being here today, and from our Adam Board. And then we'll conclude with a presentation from the Human Services Chamber of Franklin County before we go into public testimony. At its core, I know the 2026 operating budget is about keeping our city moving and making sure that the city is fulfilling its obligation to keep our lights on and our roads paved and our trash picked up and our snow plowed. And the work that we do in this committee goes a little bit further, though, from, I think, the traditional role of what local government has filled. It's about making investments in our city's most important asset, which is not our streets or our lights or our buildings or our bridges, it's our people. And those investments couldn't be more important than ever before. We see what's happening, of course, at the federal level. Just yesterday, we all woke up in the morning to indiscriminate news of $2 billion of cuts to SAMHSA funding that supports our most vulnerable neighbors living with alcohol and substance use disorders. Then that funding those notices were rescinded in an equally jarring and confusing move. You have federal freezes in funding to our tax-exempt businesses. You have absolutely absurd investigations of fraud, delaying reimbursements for services and disrupting our ability to care for our neighbors. You have cuts at the state level happening as well. We know we're facing potentially a $3.2 billion shortfall in our state's Medicaid budget for next year, which most certainly is going to impact our ability to care for our neighbors, as Medicaid is the primary payer for behavioral health services and substance use treatment and crisis care across the state of Ohio. But these aren't just federal and state issues, they're also local issues too. You see funding disruptions both at the county level, and I'm not going to sugarcoat things at the city level as well. We see in the proposed budget right now a 10% reduction in our funding for our Elevate program. We see a 53% reduction in our funding for our federally qualified healthcare centers. That helps our under and uninsured neighbors access critical healthcare services. And I say all of that not to make people angry or upset. I say all of that because I think it's important that we have an honest conversation about where we are right now, where we want to go, about the situation that we find ourselves in, and then also lead that into a conversation about who we are as a community. Because the reality is, we've talked about this a lot. This is one of the tightest budgets that we have seen in a very long time at the city. And so we can't invest resources that we don't have. And so we have to figure out as a community how we can stretch every dollar and how we can come together to have conversations about where are we able to access additional resources that might not be at our disposal today. I think coming into this hearing, I want to be pretty transparent. I have more questions still than answers. And I don't know that we're going to get all of the answers today. I know that departments are still looking through their own budget to figure out how to make as much work with the resources that they have at their disposal, and those answers might not come to us until a little bit later in the budget process. I think that we have a really unique opportunity as a community. You know, the past year we've been going through the FRAC process, the Funding Review Advisory Committee, with the hope that through that process, through having an open dialogue with our community, with our partners around the community, that we'll be able to have a good understanding of what the needs are and what the opportunities are that are available to us to be able to bridge as many gaps in our community as we can. And we know that those gaps existed before we saw any of these cuts at the federal or the state level. We know that we always probably could have done a better job at investing in our people. And so now, you know, where some people might find this tipping point a scary moment, I actually find it an exciting opportunity for us to have the honest conversations, the hard conversations. You know, I believe that I've never met a person in this city, never ever met a person in this city who, if their neighbor from next door walked across the street, knocked on the door and said, "Hey, I don't have food tonight to feed my babies," that neighbor wouldn't give them the resources that they need to be able to keep their families fed or clothed or supported in whatever way they need. And I'm here to tell you that today we find ourselves at a moment where our neighbors are knocking on our door. And I believe that this is a community that will always answer. And so, you know, again, today we're going to review what the proposed budget is in front of us. It's not a final budget. There will be changes. And have an opportunity to hear from some of our partners just about what some additional needs might be that might not be reflected in this budget that we need to be considering as we're looking at moving forward. Haley's going to kill me because I didn't read one single talking point that she wrote for me. So at this point in time, I am going to turn it over to our Deputy Director from the Department of Development, Hannah Jones, to talk to us a little bit about the work that they're doing in the human services space and what we can see in the budget this year.
Good afternoon. Thank you, Chair Green, and thank you for the opportunity to present the portion of development's budget that supports the work of the human services sector. In 2025, we started the process to close out the third year of the original Elevate cohort. This cohort represented approximately 111 organizations that serve the residents of Columbus. In the original Elevate program, we provided $10 million in funding on staggered annual cycles from 2023 through 2025. With the introduction of the Elevate All RFP, which we launched in May of this year, we've moved away from the staggered process of allocating $5 million per RFP and consolidated to a single funding cycle for the full amount in 2026. This competitive grant will provide operational support to organizations that serve households below the ALICE threshold, and ALICE stands for Asset Limited, Income Constrained, and Employed. So really, as you were saying, Council Member, more and more neighbors need more and more support in an ever-shifting landscape. So how do we take a wider lens on who and how our organizations serve our residents? However, there are focus areas that we are maintaining that are in alignment with the department's priorities around the housing continuum. And those are financial security, housing stability, homelessness, wealth building, and behavioral health and trauma. When we released the RFP last May, it was in anticipation of receiving $10 million in our 2026 budget. The RFP closed in June of 2025, and we received applications from 187 organizations totaling approximately $24.6 million. Currently, the department anticipates having the capacity to award approximately $9 million, as you alluded to earlier, in grants. We are in the process of adjusting and finalizing our recommendations to meet this new amount and anticipate making the awards when the budget is finalized, hopefully later in February. In addition to the Elevate program, I want to take an opportunity to highlight a program that we will be launching this year as well, as an example of how we in the Department of Development are continuing to partner with our human services sector and health partners to engage with our most vulnerable residents. While our goal within our department is always to prevent homelessness, we know that the need is great, and we continue to see more individuals in shelter and on the land for longer periods of time. In order to meet these residents where they are, to build trust and walk alongside them as they begin their housing journey, we are launching the CORE team later this year with the support of City Council, who passed legislation at the end of last year to get us up and running. The team will focus on unsheltered residents with the highest need, who have repeated interactions with first responders and who often experience mental health and/or substance use disorders. This initiative will directly support our broader strategy to stabilize housing for all of our residents and hopefully reduce strain on emergency and outreach systems, as well as a shelter system that is already at capacity. And with that, I'm happy to answer any questions you may have.
Thank you so much. And I was just hoping you could talk a little bit more, and maybe you can't, just about what you're imagining in terms of how Elevate might be impacted by their proposed $1 million cut. And then I also know that there was the discussion about, beyond that, a 15% cut in discretionary contracts within your department, and how you are, if you have sort of been imagining what that might look like, and if that could affect Elevate further, or, the Community Shelter Board, I think, is one of the larger external contracts that you have. I know that there are still gaps we're working really hard to fill. So how are you imagining that rolling out?
Yeah. So with the Elevate process specifically, we did a peer-to-peer review process, and that involved over 360 reviewers who reviewed it through August. They submitted surveys that helped inform a ranking process. So that ranking process aligns with those who scored the highest, and then involves some calculations and allocations based on past performance, as well as the percentage of their budget that they have applied for. So we will probably go back and look at that ranking process and how to align accordingly with the new budget amount. I think a fundamental question in front of us is if we go with the same amount of recommended organizations, and cut back the amount they get, or if we cut the number of organizations that receive awards to better align with the amount received. And that's kind of what our discussion is internally with the leadership at this moment. We have not landed on anything related to that. As far as the question you asked about the other contracts, and the requests have been made of departments to look at savings, we are still in the process of determining how we can do that, but the director has been very clear that Elevate will not see any other cuts related to that.
Okay. That's great. I've told you this already directly, but I will say it on camera just for accountability reasons. As we're working on getting that question answered, I can't vote on a budget until I know what I'm voting, like what's getting cut, what the impact is going to be for sure. So, and then I would love to have, ongoing conversations with you. I think, I talk about this up here a lot, and I've talked with you about it, but, thinking about, if we have an application before us, they've told us how much money it costs to do this work that they have to do. That's important, right? And so if we're looking at making a cut to an allocation to maintain the same amount of programs, how would a program make whole the costs that they need to be able to run services? So I think it's an interesting conversation to engage in. Okay. Well, with that, I think we will move on and, more to come related to that. Next, I would like to turn it over to our executive director from Celebrate One, Danielle Tong, to hear about their 2026 proposed budget. And thank you so much for being here today, Director Tong. Turn it over to you.
My pleasure, Chair Green. Thank you for having us here today to talk to you about our proposed 2026 budget. We are proposing a $2.3 million budget, which is a roughly 6% decrease from 2025. What that looks like in dollars and cents is around $159,000 decrease overall. Little bit of backstory here. So Celebrate One is a place-based collective impact organization that was established with partners around the Franklin County area. It includes, of course, Mayor Ginther and also members of council and members of Franklin County as well, to come together and work to reduce the infant mortality rate in Franklin County. And so that means our vision is to see that every baby celebrates his or her first birthday regardless of the race, address, or family income. With that, we'll share a little bit of our data around infant mortality. So Celebrate One was established in 2014, and we always think it's important to give an understanding of the progress rather than one single year of data. So we, in 2014, had an infant mortality rate of 8.4 deaths in every 1,000 live births, and we've seen a 12% overall decrease since that time. We know that there is a tremendous racial disparity in the babies that die in Franklin County. A little over two Black infants die than white infants in Franklin County, but we have seen decreases in both white infant mortality and Black infant mortality. So despite not having reached our goal and not going nearly far enough, we know that we're going in the right direction, and we just need to push pedal to the metal a little harder. What causes infant mortality stays particularly stagnant. The causes for infant death don't change necessarily that much, and we see that prematurity, congenital abnormalities, and in addition to sleep-related deaths. Sleep-related deaths are a smattering across the entire pie, so they're not represented in one single slice, but they are present in each of those slices. I'll turn it over to Asha for the next portions.
Thank you. My name is, sorry, that's loud. My name is Asha Bashan. I'm the Director of Operations. And here is just a snapshot of Celebrate One's personnel. Celebrate One currently has 22 full-time staff employees and 1 part-time employee. Celebrate One has 11 staff members that are funded through the city's general fund budget, and 13 whom are grant funded. 8 of them are community health workers in partnership with Columbus Public Health. And the remaining 5 positions are supported by other grant funding sources. We are also right now currently in the process of hiring 2 new positions, one of which is a community organizer, and the second is the Director of Outcomes and Evaluations, and Director Tong will talk a little bit more about that in a later slide. So this slide here outlines Celebrate One's funding sources. 30% of Celebrate One's funding sources comes from the city's general fund budget, and the remaining 70% is a mixture of state and federal grant sources, which include the Ohio Department of Medicaid, Ohio Department of Youth, Children and Youth, Franklin County Jobs and Family Services, as well as private philanthropic funding sources from our 501c3. While this diversified funding model allows us to maximize impact, it also means Celebrate One is highly sensitive to contract changes, delays, and shifting federal and state requirements. So when one funding stream is disrupted, the operational impact is immediate. So that's why the city investment is super critical. It provides predictability and allows us to responsibly manage grants partners and services upon the city's behalf. So in this next slide, as Director Tong mentioned, Celebrate One's proposed budget for 2026 is $2.3 million. These funds support the core infrastructure that allows this work to function day-to-day, which includes staffing, contract oversight, compliance, and coordination across city departments and community partners. And so to meet the growing needs of the community, we adapt our approach and we make the necessary changes. Our investment strategies shift accordingly to ensure meaningful impact and effectively address emerging needs. And I will pass it back. Oh, I went to, there we go. There we go.
All right, so we want to share a few highlights from 2025. There's a lot on this slide, and I will not go over them all, but I just wanted to highlight a couple of programs that we are really proud of. In 2025, we distributed a 33% increase in pregnancy tests. We have a partnership with Columbus Public Metropolitan Libraries to distribute pregnancy tests in every library with 0 questions asked. So it really reduces the barrier and stigma around requiring tests. So in 25, we distributed 8,560 pregnancy tests. An incredible feat, and also really lends a message around the continued need of the service. In addition, we had a 55% increase in the number of diapers distributed in 25. So that number looks like 28,683 diapers distributed, which again really does articulate the need that the community has for material assistance and support. Let's see, back one slide. There we go. So as Asha was saying, Celebrate One has a pretty sturdy structure in our partnership with the City of Columbus, having this general fund distribution, and in addition to that, having a 501c3. It does allow us some stability. However, we did see some disruptions at the state and federal level. One example of that is that we were required to return $103,000 to the State Department of Health. It was COVID-era funds that were pulled from the federal government, and Ohio Department of Health was required to rescind the remaining grants from all of its grantees, including ours. So the work that was impacted was work happening in the 43232 region, which was around fatherhood support, mental health, legal aid services, and lactation supports. In addition to that, that impact, we have also seen funding delays and contracting delays based on decision-making at the federal level. So since we have had funding delays in our maternal and infant vitality initiative funding, that's funding through the Ohio Department of Children and Youth, because of the contracting delays, Celebrate One incurred $117,000, almost $118,000 in unexpected costs in that delay. In addition, we have experienced unexpected costs to the tune of around $300,000 for a delay happening through a grant from Franklin County Job and Family Services. We definitely understand that these contracting issues, especially as they pertain to things happening in the undercurrent at the federal level, are very important. We just would like to highlight the impact on day-to-day operations for Celebrate One. So over the year of 2025, Celebrate One has adjusted operations to absorb around a little over $300,000 in unexpected expenses. So now, a little bit rosier of a discussion. Where are we headed in 2026? I have one single priority for Celebrate One in 2026, and that is to evolve our collective impact initiative from a convening and collaborating and connecting organization to an adaptive and continuous learning system. And what that means for me is that we not only bring people to the table, glean their experiences, and also learn from collected data, but that we are using that information to learn and to adapt and to innovate. So the key strategies that we're deploying in order to fulfill that priority, number one is to establish an infrastructure of shared measurement that aligns across partners. So essentially what that means is I'll use this example of if you think of a car and you're driving forward, but that car has no windshield. It only has a big sheet of metal where the windshield should be. And the information that you're using to guide your car forward is from your rear view mirrors and your side mirrors. It doesn't give you the information that you need to make sure you're reaching the destination, especially safely. That is the position we find ourselves in for a myriad of reasons, particularly data coming from our state partners has a significant lag. And so we have engaged in work to build the windshield for Franklin County to ensure that we know where we're headed, where we're going, and whether what we're doing is working and how much. It helps us make decisions, and that's really what a continuous learning system should do. The second piece of our second strategy, is to ensure community engagement. So some of our information has always been qualitative and some has always been quantitative, but it's important for us to ensure that families, so not just our partners, the folks who work in this space, our professionals, to be around the table, but that the table is made for people who are experiencing this issue to have a seat at the table, not as clients, not only as clients, but also as decision makers and as folks building as we climb. So we have the two positions that Asha spoke to earlier are both grant-funded positions, and they are a director of program evaluation whose responsibility is to evaluate the success of the collective impact. It's a very data skill set heavy position. They're responsible not only for evaluating the effectiveness of Celebrate One, our four walls, but also what is happening across partnership through the collective. The second position is a community organizer whose job is to ensure that we're making seats at the table and also building the pathway to the table and inviting people and walking beside them to the table, making sure that it's welcoming for them and that they feel like this is for all of us as a community. So those positions are well underway in their hiring stage. We look forward to starting interviews within the next 2 weeks for both of those and having them both fully online in mid-April. The third is about building relationships with funding partners who really get what it means to fund collective impact. So as Asha shared, we are 70% grant funded, and we often find ourselves in a position to pitch programmatic dollars. What does it look like to run a program that provides a direct service to a client? And we do have direct service parts of our organization, but our primary responsibility is to move the collective, and that is not always direct service work. So we are eager to build relationships with funding partners who know how to fund collective impact work. And so this really encompasses our strategy for moving us into 2026 and beyond at fully leaning into our space as a collective impact for Franklin County. And with that, I'm thrilled to take questions.
Wow. Thank you so much for the work that you do every day. And I know that I'm very grateful that you shared some of the challenges related to funding in this hearing. I think often it's so interesting. So, kind of coming from this world outside of council, all of us who rely on grant funding or reimbursement in order to keep the ship, moving, keep the ship sailing, know so intimately those downstream effects when there's, even just a slight delay in funding. 10 months, that's a long time to be encumbering costs. And then, and I think so often those who have sat in this seat, you don't have that sort of intimate knowledge or understanding. And, there's this, it's easy when you have a general fund budget that's, supporting you. We've got revenue coming in all the time. It's not these are real systemic issues that we're dealing with. And I think as a community, it's important for us to talk about those on, both on the micro level, on the individual level, as it affects your programs and others' programs around the community. But I also think that, we also need to be thinking about that reality proactively. I think there's, a fair amount of misunderstanding or even stigma, I guess I would say. I think, often rather than looking at the proliferation of this type of issue across many, many different organizations and partners across the community, and sitting back and thinking, hey, that seems like a system issue. How can we alleviate some of that stress, even if it's just on our own internal operations? How can we not be a part of that problem? And is there something more that we can do to address it? So often I think we point a finger at an organization, as if they have created a problem or mismanaged money, when really we have these much larger challenges ahead of us to solve. So it's something that's like just stay in communication about too, and figure out if where and if we can lean in if there's other problems, which I expect there will be. Okay. Well, I think with that, oh heavens. With that, I will turn it over to our Assistant Health Commissioner, Anita Clark, who's going to give us an overview of our budget here at Columbus Public Health. CPH, much like and more so than even Celebrate One, the general fund is a portion of your budget, much larger portion, I know, comes from grant funds, and in both areas, I think a fair amount of exposure for funding for critical work at the federal level, certainly. So we'll turn it over to you now to talk more.
Thank you. Good afternoon, Councilmember Green and the staff members of Council. I am really pleased to be here to join you on behalf of Health Commissioner Dr. Mashika Roberts. I think many of you already know that she had an unexpected death of her mother recently, so our thoughts are with her. Thank you for this opportunity to highlight Columbus Public Health proposed 2026 budget of over $45 million. We want to go ahead and do the PowerPoint. Thank you. And this really enables us to protect the health and safety of our community and the residents that we all serve. While our budget decreased by a little more than $500,000, it decreased by a little over $500,000. It's about 3.3% reduction. Health was able to submit a balanced budget, and that took some work. It was very hard to come together and decide on what we were going to keep in the budget and what needed to come out of the budget. But we did succeed, and with that, Councilmember Green, you mentioned our federally qualified health centers. We did need to reduce that budget from a little under $4.3 million to $2 million, and that is going to affect our community. This budget also includes $39 million for personnel cost. I think all of us understand that things are just more expensive, and our insurance is almost 20% more today than it was, 2 years ago, and I think that's impactful for our budgets. We also had funding that had ended, the ARPA funding, and we had 14 positions, actually 13 on ARPA, and one was also with housing and development that we needed to absorb in the budget. And they were critical positions. These were positions that involved our youth, our family engagement, voice programming, care coalition, and then, of course, housing. With this budget, with our personnel, we're able to sustain 327 positions, full-time positions, and 16 part-time positions. That was an increase of 2 from the previous year. Not a lot, but as you can see with the inflation of cost, that is where a lot of it's going. Additionally, we are fortunate to provide revenue from our public health services, and we've worked really hard to increase those revenues. I do want to talk a little bit about our data and what it looks like for our grants as well. Go ahead and forward to the next. Go ahead. Right there. I did not make a mistake. That is 2024 information. I would love to have 2025 information, but it takes about 2 months to configure. And Susan Hager, who is our fiscal manager here tonight, works pretty much 8 weeks to get it together, and it's an annual financial report that goes to the state of Ohio. But I think this really shows the piece of the pie for health, and we bring in revenue of about 12%. And then 41% is covered by our city subsidy, and then we're funded 45% from grants. We are working very hard to get CARF accreditation, and that's a Commission on Accreditation of Rehabilitation Facilities. And that will help us really streamline our practices and start building up ability to bill more in our behavioral health services. And I have some good news, Councilmember Green. We actually did our first billing in our Hope at Home program just recently. We haven't got the revenue yet, but we have billed for it. And our plan is to continue to add services in our neighborhood social work program throughout the year. And then with the CARF funding, I think that's just going to be an enhancement. So I look for that percentage for revenue to go up. And I'm going to kind of hold Susan Hager accountable for that next year. Okay, Susan? All right. You had mentioned something about grants, and we're concerned right now at this point. As I had mentioned, 45% of our funding, if you look at the total costs in 2024, almost $80 million makes up a budget. Some city subsidies, some grants. We have our WIC program at $7 million, Ryan White $4.9 million, HRSA EHE grant $2 million, Healthy Start 1.2, our Title 10 reproductive health at about $763,000, but we also bill for our providers too, so we have additional revenue coming in with that. But should there be additional federal cuts, that's worrisome to us, and our programs could be at jeopardy. You mentioned SAMHSA. That was a huge scare for us yesterday. It rescinded, later in the evening. But I think that it tells us something. We've really got to really have some solid funding and try to diversify the funding we do have based on the amount of funding we have coming in. We've got to continue our programs. And I think all of us see in the headlines the unpredictability and unsettling year for the federal government. It's really concerning to all of us. Despite the unsettlement of the political climate and attacks on public health, we prevailed in 2025. Last year, we helped increase life expectancy to 76.1 years, regaining all the years that we lost through the pandemic. So I think that is a definite win. Additionally, homicides were under 100 for the first time since 2013. Preliminary overdose deaths were at 188, down from the pandemic high of 805. And the Columbus smoking rate fell to an all-time low of 11.2%. So we did have some really good successes in 2025. Columbus is proud to join with in our work to protect the health and improve the lives of all residents. We appreciate the support and the partnership of City Council as we continue this critical public health work on behalf of our residents and community. I'd be happy to take questions now, or do you want me to pass it off to our next portion of the alternative crisis response team?
Let me just make a comment about this portion, and then we'll transition to the alternate crisis discussion.
Sure.
I think what was so troubling about the SAMHSA notification is I don't even think it's been officially rescinded yet. It's just unofficial comments from government officials. There's been no sending out of new letters. And there's just no explanation of we messed up or that was a mistake. They're not saying this was a mistake. They're just walking it back. And so I think that is what is incredibly troubling about this work that we have to fund, and every other organization in our community that is facing this challenge right now as well, that is in an even less stable position without, the backing of a general fund or, is how do we imagine being able to fill that gap? Or how do is there a pathway where as a community we could imagine trying to become as self-reliant or, building up some defenses that would allow us to move through further disruptions in a way where we're still able to serve our residents. And then I also just wanted to ask a question about, well, first of all, I just wanted to say, again, thank you for being here. And I am so excited about the ways in which CPH is really looking at diversifying funding streams and blending and braiding funding to be able to make services whole. The billing for services and being able to bring in reimbursements for those, I think is a really incredible thing, as well as the adoption of the new electronic health record, and improving efficiencies, being able to use the best tools that are available to us. Do you anticipate, is there a way that we can kind of, or how are you planning on tracking, I guess, additional revenue that we're bringing in, so that we can kind of be thoughtful of that as we're looking at next year's budget, assuming nothing wild happens, right? I see us being in a position where if we're bringing in additional revenue, we may need to transition resources to a different place that might be less funded, or, I don't know, I'm just kind of speaking, very generally here, but how do you imagine the process of tracking the impact of these changes financially? And is that something we can kind of stay on the lookout for?
Oh, I absolutely think so. We do monthly tracking. We're all about data at Columbus Public Health, and we're always looking at our numbers. I think that we need to, really do an assessment of the revenue that's coming in, and I love what you said. We really need to be looking at other sources other than federal dollars. And then we really need to look at the priorities at Columbus Public Health and just health in general. What are our essential functions that we have to continue? We've had many scares in 2025 with federal dollars. And some even, we actually had a grant that was withdrawn from us. Fortunately, we were able to get funding for that back, but it took a lot of litigation to do that. And so that took a lot of time and effort for everyone, but it was successful. So we will plan to look at our priorities and then realign those funds as we get those in. And we'll be tracking the revenue. You'll definitely hear that report. And I'm hoping that it will be well beyond the $12 million that we've included in the budget for 2026.
Well, I'll be looking forward to that. And, I think it makes me think of Deputy Director Jones. I think we kind of talked on this a little bit a week or so ago, but just thinking about ways in which we can be more efficient as a city. And when we're thinking about distributing funding to to members of our community, there's a few different places where in the city we're funding after school programs, that all have different application processes and potentially different goals or ways that they're being evaluated. And, the same is true for lots of other different types of external partnerships that we're forming. And so thinking about, is there a way where we can adopt a better collective impact model and align goals and priorities so that we are stretching dollars further? And I don't even know if there's opportunity for partnership with the Adam Board, who does community planning, every year, to figure out how we can maybe tag along on your journey, so that we're making sure that we're funding community goals strategically in alignment with what we're learning from that process as well. So lots of opportunity. And then I just want to acknowledge our council member, Tiara Ross, who joined us today. Tiara, did you want to say anything? You're here just for the right part because we're getting ready to transition to alternate crisis. Okay. Okay, well, thank you so much. And then Anita, I think I'll just let you keep you keep rolling into alternate crisis now, and then, does that sound good?
That sounds good. I have my partners and friends here today. I have Deputy Director Halloran and Deputy Director Wenzel, who are going to be presenting on some of it, and then they'll pass it back to me. I'm going to go ahead and okay. Oh, there we go. Okay, all right. Take it from there. Thank you.
Yeah, thank you, Anita. Chair Green, thank you for the opportunity to be here today. In January of 2025, Columbus Public Health and the Department of Public Safety presented an overview of the city's existing alternative response programs to council. At that hearing, we listed several objectives, plans for 2025. I wanted to take a moment to update this council on those actions that we've taken. First, the Emergency Communications Center has continued to hire 911 call takers and dispatchers. With this additional staffing, the ECC can assign dispatchers to staff the right response unit. Dispatchers within RRU support and facilitate the care that's provided by the RRU clinicians. Additionally, the Emergency Communications Center now collaborates with 988 24 hours a day. The ECC transfers calls to 988 during non-RRU hours, which includes third shift and weekends. The ECC also transfers calls to 988 during RRU's operational hours whenever RRU clinicians are unavailable. This operation expands access to mental health services to our residents. REACT now has van-style ambulances called Alternative Response Vehicles, or ARVs. These ARVs create a therapeutic environment and provide privacy for interactions with our patients. They also provide a space to provide treatment when that's needed. And then finally, the Division of Fires and Police are transporting patients in crisis to the Franklin County Crisis Care Center, which we started to do earlier or later in 2025. Looking forward to 2026, and given our tight physical environment, safety's focus is to maintain our service levels and to make the most of opportunities to enhance those services. We look forward to completing our project with mission-critical partners and then working collaboratively with Columbus Public Health and community partners to improve and expand our alternative response programs. Public Safety Deputy Director Tricia Wenzel will now provide an overview of safety's fiscal investment in alternative response.
Thank you, Michael. Chair Green and Councilmember Ross, thank you for having us here this evening to talk a little bit more about our alternative response programs. I'm going to go over the public safety component of the budget and then go kind of back and forth with public health to capture their portion of the investment. So overall, public safety's portion is $5.2 million in personnel costs for the 2026 budget. 4.56 million of that comes from the general fund, and then we do have a grant-funded portion that's approximately $683,000. Going first to our mobile crisis response unit, we have one social worker there from fire, and that's at a cost of $135,780. We also have a police sergeant and 5 police officers. Our total investment for the mobile crisis response program out of public safety is $1.26 million. And I'll turn it over to Anita Clark for the health portion of that unit.
Actually, so then just to clarify, so total under public safety is 5.2 million. Okay, I guess I probably should have teed this up a little bit. So the way that we're imagining this is from a whole systems approach, right? So we've got many different partners sitting around the table that are funding lots of really important work. That's all integrating together. So now the work ahead of us is the part of integrating. So it's of course not just the city, which is why we invited the Adam board here, because you have invested a lot and continue to invest a lot in our crisis continuum as well. So we want to paint that full picture. But yes, thank you. Okay, just wanted to clarify. So 5.2 million total, and then it's like the 1.6 for staffing for one, and so on and so forth. Okay, thank you. Go ahead.
All right, as far as health with our mobile crisis response team, we have 7 FTEs for a total cost of $925,000. And the 7 FTEs cover our 5 CCCs, clinical counselors, and then one's a supervisor, and then one's a program manager as well. So I'll pass it back over to Deputy Director Wenzel.
Next, we have the Right Response Unit, and for that unit, we have 2 911 dispatchers assigned from our Division of Support Services. This is an estimated cost because those are not 2 people that are dedicated to it all the time. We rotate, but it's normally our more seasoned dispatchers that are in those positions, or sitting in those chairs, I should say. And for public safety, the cost there is approximately $255,000.
Right. And then we have our Right Response Unit with our 8 full-time employees and then 2 part-time employees for a little bit over $1 million for that cost.
And then we have our Spark and React programs, along with their joint program supervision and operation oversight. For that, we have 5 supervisors, 8 people dedicated to Spark, and 9 to React, for a total of 22 public safety employees, and a total public safety cost of $3.7 million in 2026. And just to kind of go over the overall with safety and health combined, I had calculated approximately $6.8 million in personnel costs for 2026. And that was all I had for public safety. Unless there are questions, we were going to turn it back over to public health for a few more comments.
In addition, the mayor has allocated an additional $1 million to enhance our existing alternative crisis response efforts. Specifically, this funding will create a civilian response team, add 1 clinician to the Right Response Unit, create a community advisory panel, and provide a therapy dog to the mobile crisis response team. I think that concludes our discussion on alternative response services. If you have any additional questions, happy to answer those.
Okay, so then for the next year, we're anticipating 4 clinicians total and 2 peer supporters at the city, is that right? That's what I have in my notes, but they didn't come from you.
For the civilian team?
I think so, yes.
2 clinicians and then 2 peer supporters with 1 program manager.
Okay,
And we're really at the birthing part of this. I mean, we're still in creation of this, so we're taking steps towards that. And it'll take us probably most of the year to get this established, or at least a good 6 months.
and so then those individuals will live under public health?
Correct.
And is the goal, I'm assuming probably not 24-hour staffing, but
It'll be hours that we're anticipating, a Monday through Friday during core hours of mobile crisis response too. We want them to have, and this really is a pilot, I mean, it's not enough civilian teams. I think that you heard during the Mission Critical Partners assessment, Dr. Beavis had mentioned that she thought we needed to have at least 5 teams. I think we're starting out small, and this would be something we'd have to build up to. And really, checking to see when the hours, but I think it would be best if we had the same hours that mobile crisis response would be available if need be.
is there a thought to, so bringing those services in-house, those clinical, crisis services in-house versus contracting that out with a crisis provider who we could integrate into our team where they might have more ability to bill for services or have existing infrastructure that they could tap into? Did we give much consideration to that?
Not at this time, but I think we would be open for discussions about it.
Okay.
Just to be able to and we do have some wonderful collaboration with our teams already existing out in the community. I know that NetCare partners very well with us, and they have a civilian team that's, working 24/7. So that's something I think that we can have some discussions about.
Okay, more to come then. Not married to anything either way, but just thinking on live TV, which everyone hates when I do. Okay, and then last but certainly not least for this, I will pass the floor over to Monica Sarazuela, who joined us from the Adam Board today. And the Adam Board over the last number of years has just invested an unimaginable amount of time and love and funding into our crisis continuum, stepped up to the table to fund 988 when no other funding source existed, stepped up to the table to build a place for people in crisis to go and be able to receive the supports that they need through our crisis care center, and it continues to staff that. And then I know also funds several mobile crisis teams out in the community, and so has been such a great partner. So excited to hear more from you.
All right. Well, thank you, Chair Green, Councilmember Ross, and Cabinet Directors. My name is Monica Sarazuela. I serve as the Senior Director of Government Affairs at the Alcohol, Drug, and Mental Health Board of Franklin County, also known as ADAMH. On behalf of ADAMH CEO Erica Clark-Jones, thank you for inviting us to be here tonight to share an overview of ADAMH's investments in the crisis services space and our support of the broader crisis care continuum. I want to begin by just acknowledging and thanking the many partners in the room, including Columbus Public Health and Columbus Department of Public Safety, who have worked alongside ADAMH to shape and carry out a shared vision of building a crisis system that is accessible, coordinated, and responsive to residents no matter the crisis they are facing. And I want to quickly level set again on ADAMH's role in the community. So we as the ADAMH Board, we serve as the County Behavioral Health Authority for Franklin County. We are statutorily empowered by the Ohio Revised Code to plan, fund, and evaluate behavioral health services in Franklin County. We are not allowed to provide direct services, but rather we contract with and support around 50 community-based nonprofit providers who deliver care across what we describe as 6 systems of care, which are prevention, treatment, recovery supports, housing, family supports, and crisis. And so this slide here, as you can see, is a breakdown of ADAMH's investment portfolio for 2026. And you will see that ADAMH plans to invest nearly $100 million into the Franklin County Behavioral Health Safety Net this year. When we look at where those investments are concentrated, you will see crisis services represents ADAMH's second largest investment with $30.8 million allocated for 2026 in this space. And these investments are made possible largely through our property tax levy, which accounts for 77% of ADAMH's revenue. And calendar year 2026 represents the final year of ADAMH's current levy cycle. Beginning in 2027, the levy approved by Franklin County voters this past November will go into effect, allowing us to collect revenue at the new levy rate to continue sustaining and expanding these critical services. So a little bit more about those crisis investments. So again, nearly $31 million going towards crisis. And at ADAMH, our kind of guiding principle to those investments is that, we believe that when someone is experiencing a behavioral health crisis, they should have someone to call, someone to come, and somewhere to go. And so talking a little bit more about those investments, first with our support of crisis lines. ADAMH continues to support multiple crisis call lines, again, that someone to call piece, operating across Franklin County. We are awaiting fourth quarter 2025 data, but there were more than 74,000 calls to Franklin County crisis lines in quarter 1 through 3 of 2025. And that figure includes calls to 988, calls to the Nationwide Children's Hospital Suicide Prevention Line for Youth, the NetCare 276 Care Line, as well as the Columbus Right Response Unit. Moving on to kind of our support of mobile crisis teams. AdamH has been a long funder of mobile and community-based crisis response programs. And again, that's that someone to come piece. These are operated by our provider network. The programs that we help fund include the adult mobile crisis teams supported by NetCare, which are dispatched through 988 and available 24 hours a day, 7 days a week. And those are a clinician and a peer responding to an individual in crisis. Next, we also support NetCare's Community Crisis Response Team, which responds to larger scale crisis events and is frequently requested by the Columbus Police Department. We also help fund NetCare's Row 1 outreach workers who transport individuals who are publicly inebriated to Mary Haven's Engagement Center rather than to jail or emergency departments. We also help fund NetCare's probate pre-screeners who assess individuals out in the community to determine whether involuntary hospitalization may be clinically necessary. And then we also support Southeast Healthcare's REACT team, which provides mobile response to overdose situations. And then lastly, Chair Green, as you mentioned, the final component of this crisis care continuum is having a safe, person-centered location for individuals to go when they need immediate care. And our solution to that was the Franklin County Crisis Care Center, which officially opened its doors on September 2nd of last year. The center currently operates with, again, 23-hour observation capacity for up to 40 individuals, integrated discharge planning and on-site pharmacy services, and dedicated entry points for both the public and our first responders. With the recent passage of the AdamH levy, the Crisis Care Center can move forward with the plans to bring kind of these other phases on in the coming years. And that includes an additional 20 seats in the 23-hour observation, bringing the behavioral health urgent care online, and the 16-bed inpatient unit on the second floor as well. So since opening last September, there have been 1,861 encounters at the Franklin County Crisis Care Center, with 54% of those brought in by either law enforcement, EMS, or the mobile crisis teams. For calendar year 2026, AdamH is going to invest more than $11 million to support the ongoing operations of the Crisis Center through the operator recovery innovations. And Chair Green, you and I have had conversations over the years. When we think about the sustainable funding of the center, the state of Ohio and the DeWine administration has done a great job of investing in building out elements of the crisis care continuum across the state, but we have yet to see a sustainable statewide financing model for facility-based crisis care. Until we get to that point, local systems like AdamH boards have to absorb most of that cost, and that is what we have to do for the Franklin County Crisis Care Center until the state possibly makes some updated changes. Another point I just want to call out tonight is many of the data points I shared this evening are a result of the strong collaboration and work through the Crisis Care Advisory Council, in which the City of Columbus is an active participant in and is represented. And this group comes together to share knowledge and expertise and gives guidance to AdamH on how we can identify data sources, participate in different data reviews, and just overall offer insights in how we can continue to build a crisis care system to ensure our community needs are being met. And I'll just close out tonight by saying, again, thank you, Chair Green. Our investments in the crisis care system reflect a long-term, voter-supported commitment to ensuring that every Franklin County resident has access to timely and appropriate behavioral health crisis care. The progress has been made and the work still lies ahead. That will depend on the continued collaboration across jurisdictions and systems. The City of Columbus has been and remains a critical partner in this effort, and AdamH deeply, deeply values this partnership. Again, thank you for the invitation tonight, and I'm happy to answer any questions.
Thank you so much for being here. And I mean, so now you can see crisis services is such a large chunk of your pie. It is literally a type of service that pretty much did not exist before, and now it is comprising almost a third of the entire Adam board budget. Can you help me understand if that has had an impact on, our ability through the Adam levy to continue funding providers outside of the crisis system, or?
Yeah, so with the passage of the Adam H. levy, it will, because we were able to go for a renewal plus a small increase, we will be able to sustain the current investments in our system and then also have the ability to expand in some areas. This year is a kind of a big planning year for us as we embark on that next levy cycle in 2027. And again, we have a 10-year levy cycle to work under this time, which is amazing. So a lot of planning is going on right now. And again, it's the collaboration and the input from other stakeholders will be critical to, as we think about where are areas that we should be expanding when we think about our systems of care.
Yeah, especially because, I think looking at the numbers, I imagine right now the Adam Board as the primary funder of crisis services in our county. I think that's fair to say. And so as we're having conversations about how to expand our alternate crisis programs, I think it's really important that we're conscious of, our need as a city to make sure that we're investing in those expanded services, and figuring out, I think that, I, like probably many people, were under the assumption that there would be a revenue stream to fund these crisis services that are getting stood up around the state. And so, as we eagerly await, I know that the DeWine administration, truly to their credit, is fully committed to the crisis continuum. I think it is their number one priority in these last few years. So not meant to knock them at all, but as I said at the beginning of this hearing, you can only spend, money that you have. And so, I think for us, even as we're imagining the full continuum of care, not even just the crisis continuum, $100 million a year invested into our behavioral health care system in Franklin County. It sounds like a lot of money, but for most provider organizations, I think Adam funds probably only make up about a quarter of their revenues, right? And
Just depends, yeah.
yeah, depending on the organization. And so then, again, it's like thinking about the entire system and thinking about the vulnerabilities in it. If we see further cuts at the federal level or further restrictions in access to Medicaid reimbursements or further, disruptions in managed care reimbursements, just again, the added strain that would put on an entity like the Adam Board. And I only mention that just so that we're being proactive as we are budgeting and as we are thinking as a city of how to be a good partner if the worst arises, that, we may be called to respond in that moment, and we should be considering that now. So thank you for being here, and sincerely thank you for all of your investments.
Thank you for the partnership.
Councilmember Ross, anything before I move to public comment? Oh, and now we have the Human Services Chamber. Is Michael Corey on? Yes. So at this time, I will move to the invited speaker portion of our hearing, and we will hear a presentation from Michael Corey and Lauren Sands of the Human Services Chamber of Franklin County, and they will be delivering this testimony remotely this evening.
Thank you, council member. I'm here with my 6-year-old Elijah, who is on TV and is a little under the weather. So thank you for allowing us to testify remotely today. What we want to share at the Human Service Chamber, which is an organization that please stop, bud, which serves about 230 health and human services nonprofits in Columbus. What we want to share isn't terribly distinct from what we shared in the fall to the Funding Review Advisory Committee, nor is it terribly distinct from what we submitted to the public in November when we published our 2025 State of the Sector report. The key lines are these. Demand is up, resources are way down, and that juxtaposition is likely to worsen over the course of this year. That's the take-home message that I'd like you to remember. Elijah, please stop. So there are a few developments that are new that I'll share that have happened since November that are worth entering into the record. There's been a surge of immigration enforcement here that's created new costs and new anxieties for our sector. That is ongoing and escalating in real time. The shutdown, which was the longest in American history, created a crisis around food access and SNAP and in other areas that's still being felt by people across the community. There was about a month of panic for our shelter providers and our folks that house people experiencing homelessness with a NOFO from HUD that was going to abbreviate a 2-year agreement and throw funding priorities and bipartisan approaches to housing people into disarray. That has been blocked in court. That's on pause now too, but that was a very stressful element that's happened since November. Just yesterday, as several have noted now, without any notice, there was about $2 billion that almost ceased flowing immediately. That doesn't portend well for things, and it's just another moral blow for the sector here and across the United States. We're all bracing for the Medicaid and SNAP cuts that were created in the bill that passed out of Congress last year. Those are still forthcoming in terms of the big hits that will hit big chunks of our sector and certainly big chunks of our community. And at the state level, we're watching with trepidation what's happening with property taxes, and the capital budget process is delayed in getting initiated here. So folks are wondering what capital budget dollars will be available from the state, among many other pieces of note as the General Assembly prepares to get back to work later this month. So there's a lot that's moving. I wanted to share a few additional data points and then let my colleague Lauren speak to some highlights from a forthcoming report that talks about the growth in our community and that relevance alone to all of this work. The numbers I want to share here are reflected in national reports, including a brand new one from an organization called Independent Sector. The demand being way up, the costs being way up to deliver services, the resources available being way down. That's consistent across the board. To wit, demand was up between January and the fall for 72% of our members. And that was before a lot of the crises that we've talked about the last few months. That is not a sustainable measure. And even before a lot of these big changes come, a significant majority of our members can't meet the current demand for services, though they're doing incredible Herculean work and delivering all sorts of wins in individual people's lives and households' lives in the subsectors that they're in. On the whole, the sector is deeply challenged to meet this growing need, while the cost of living in the United States has changed so dramatically over the last few years. Let me note a few elements of a report that we co-commissioned from an organization called CoHERE. I think these are worth flagging as goals as we try to look through and beyond some of these immediate challenges. This is, I think, important to do in spite of everything as we try to imagine what a resilient system could look like if we make the investments we need to make rather than making cuts in real time. While we know that the local obligations are unfairly having to increase, while state and federal investments become increasingly unstable and uncertain, we need to stabilize the system. CoHERE is an entity out of Cincinnati, and they surveyed our members. They did focus groups with our members. And here are some of the things they recommended to get to a resilient system. One is align on a shared investment strategy as a community. That makes a lot of sense. Nonprofits have to collaborate more, so do funders. 2, launch emergency and workforce funds. That's incredibly important. To wit, we think about 500 people have been laid off within our membership in the last 12 months. That number increased just yesterday. We need to stabilize the workforce to meet that growing need. We need funds to help navigate that. We need to build infrastructure for long-term impact. That's something that everybody can get behind, but that does still cost money. And we need to engage stakeholders across sectors. We've all been working at that for years, but we need to take that to the next level in the environment that we find ourselves in. Furthermore, focusing on the trust and building on the trust that does exist in nonprofits here and across the U.S., but then expanding that into the way that we fund and support and evolve the work to meet rapidly changing needs in the community. That was another piece that Cohere highlighted. And lastly, being flexible. We have to be flexible to everything that's happening. We saw that with the shutdown and the way funders in the community respond to that, and certainly the nonprofit providers. But we knew, and we know, that putting all the burden on feeding people onto food pantries and the food banks that supply them isn't sustainable. That's what we have to avoid as we look at what's coming down the pike with the big changes to SNAP and Medicaid a few years down the road, creating pressures not just on subsectors, but on the whole. And whether one of our members is directly in this kind of work, the so-called basic needs, the social determinants of health, everyone's affected by all of these changes, either directly or indirectly in the sector. So we have to think cohesively about supporting the sector with the local dollars we have. And at the moment, the city's proposing cuts and the county's enacted cuts in the budget. And it's unfair to put that burden on local government, but it is there. We need everybody to step up. And we're waiting with bated breath on the Funding Review Advisory Committee's report later this quarter or year. We know that will be a key part of this, but we can move now, and we need to move now to make sure we're shoring up nonprofits' ability to meet this wonderful community's growth and needs. So with that, Lauren, if you'd kind of talk through some of what Dr. Lafayette has put and shared in his forthcoming report, that'd be helpful.
Thank you, Michael. Good evening. My name is Lauren Sands, and I'm here to share some key findings from a forthcoming report by Dr. Bill Lafayette of Regionomics on Columbus's future community needs. We're still pouring through the report, but the central message of this 100-page report is that Columbus is growing, and so is the number of residents who will need health and human services. While this isn't new information, some of the particulars are worth elevating for City Council's consideration. Columbus's metro population is currently 2.225 million people and is projected to reach 2.47 million by 2035 and 2.69 million by 2050. Franklin County's population is projected to grow from its current 1.3 million to 1.64 million by 2050. As an aside, the foreign-born population across the Columbus metro area is expected to increase by nearly 100,000 people by 2050, with the majority settling in Franklin County. That figure is in spite of the abrupt changes to immigration over the last 12 months and those that are expected to continue in the short term. With more people comes more people experiencing poverty. Today, we have about 400,000 households experiencing poverty in Franklin County. By 2035, this report projects more than 460,000 Franklin County households in poverty and over 500,000 by 2050. These population trends underscore an urgent need for proactive and sustained investment in our health and human services infrastructure. Thank you for the opportunity to share these findings.
Thank you, Lauren. Councilmember, we invite any questions you may have at this time.
Thank you so much for both of you for being here, and definitely A+ dad dealing with a sick kid and still making time to advocate for your members and for our neighbors. And so I just think that is really awesome. So we appreciate you. Question for you. Can you just highlight a little bit, I think, correct me if I'm wrong, so the numbers that we were working with from the FRAC committee looked to around a $150 million gap in funding for, it was a range, like $120 million to $150 million gap in funding for human services organizations, and that was before federal and state cuts. Is that right?
That was Cohere's finding, yes.
Yeah, Cohere's finding. Okay, and then about a $50 million cut to, or $50 million gap for our emergency shelter system. So we're talking about $200 million, or I don't know, finance people in the room in the scope of a city budget, about 1/4 of it, right? A little less than, about 1/4 of our entire city budget. That was the gap that existed before cuts were made to state and federal funding. So that's a number you can't just rearrange the deck chairs on. what would the Human Services Chamber's recommendation be for how we can best in the immediate term and then in the long term bridge those gaps?
Well, there's not enough time for that conversation, but I think the succinct answer is we have to reprioritize where we spend what we have currently, which is never fun. We also have to identify new revenue streams from multiple sources and from multiple sectors so that we can ensure this community is getting what it needs to grow and prosper. Right now, we're not doing that. One of the benefits of the FRAC is that they have been charged with coming up with some ideas, but the work doesn't end with the FRAC report, good as I'm sure that it will be. We have to continue working with cities across the United States to identify opportunities to do that because we're all going through this at once. Mm-hmm. Every city and county is having to deal with these pressures, and every city and county has the opportunity to work together to figure this out. If it were me, I'd be looking at ways to raise immediate funds. That's rearranging what we currently spend, while concurrently looking at ways to raise funds, I would say, over the next 18 to 24 months as some of these SNAP and Medicaid challenges become much more acute. And we have to be looking at ways to generate considerable sums of local dollars down the road, knowing that those larger pieces can't be moved quickly, as you noted. It should not be this way, but it is. I think it's going to require looking at things like sector-wide levies and income tax reconsiderations. I think it's going to require going to our corporate community and other communities that have resources to make all of this community better. We can't do this just on social entrepreneurship or stick-to-itiveness or working harder to generate grants. There just isn't enough out there that's being identified across the country. Mm-hmm. We have to reprioritize what we do with our local dollars, not just government dollars, but philanthropic and otherwise. And we have to be able to make some tough decisions to focus on what people need. Mm-hmm. It is not hard, not easy to do, but this is the moment that we're in, and it's not going to be a moment. This is going to be more than a couple of years or a couple of election cycles of change. This is a generational shift that's happening while we walk away from the federal government having the substantial role in funding this kind of work that it's had since 1964. So it behooves all of us to be creative and work with other communities as well as within our community to identify solutions that get to work fast while also preparing for the long term. We can do both of those things at once. And we know in a crisis, this community steps up time and time again, just as it did with the SNAP crisis that the federal government shutdown created. And the city and county did really wonderful things then. And some of my predecessors that spoke today are great partners. We have such a wonderful relationship with Adam H. And hi, Monica, nice to see you. I'm sorry I'm not there. We were working together yesterday to figure out what's the local impact of this cut going to be, and then texted each other at 10 o'clock at night with great relief. Well, I guess it's not going to happen yet. And we have great relationships with the folks at Columbus Public Health, navigating the same darn challenges that the nonprofits are. We all are reliant on one another to figure this out. We can't control what's happening elsewhere. We can control what we're doing here, and we got to do more.
Mm-hmm. Well, I value and appreciate your partnership. I'm sorry we didn't get to connect before this hearing, but, if it sounds like there's a lot more work ahead, generally I feel like if I could sum up what I'm hearing here from everyone, there are more people that need help than ever before. The cost of providing help is more expensive than it used to be. The funding, if you're lucky, has remained stagnant, but across every funding sector is, for the most part, being reduced. Our city is growing, so we have more people that need help proportionate to the growth than what we did in the past. And we have to step up. Right? Does that sound right? Okay. Well, thank you so much for being here today, Michael, and more to come.
Thank you, Councilmember. Is Councilmember Ross still there?
Yes.
Hi, Councilmember Ross. I'm sorry I'm not there in person. We'll see you for official business later on.
Hi, friends. Good to see you.
Councilmember Ross had the indignity of being my law school classmate, so We'll see you later. Thank you, Councilmember Green, for hosting this hearing, and I look forward to further conversation and action.
Absolutely. Thank you. Okie dokie. So at this point, we are going to transition to our public comment portion of the hearing. As of today's 12 p.m. deadline, we only had 3 speakers sign up to speak, so we are rounding third base here, folks. Thanks for hanging in here. So each speaker will be invited to the podium and have 3 minutes to speak. A timer will be visible on the screen on the right, and a buzzer will sound when your time has lapsed. We appreciate your testimony and continued advocacy. And when you come up to the podium, if you could just please share your name and any organizations you are here representing, that would be wonderful. And so first, we are going to start today with Dr. Ria Debussy from Equitas Health.
Hey, thank you all so much for hosting today's hearing. As the council member mentioned, my name is Dr. Ria Debussy, pronouns are she, her, and I'm representing Equitas Health. So I'm the Director of External Affairs at Equitas Health, which is headquartered here in Columbus. And as you're likely aware, we're a nonprofit community health center and one of the largest LGBTQ+ and HIV/AIDS serving healthcare orgs in the country. I'm super thankful for the opportunity to address you all today, and I'm here to really just underscore the importance of funding HIV treatment prevention and resource programs throughout the city, particularly in an era where we're seeing these programs consistently under attack from the federal government. So as you know, the city, when they're executing their budget, reallocates these federal and state dollars from various other programs like the Ryan White HIV/AIDS program, housing opportunities for people with AIDS, and others to nonprofit healthcare orgs like Equitas Health. And last fiscal year, council authorized an increase to our agency's share of Ryan White Part A funding, and we hope that the city will continue to fund our efforts at a similar rate. And regarding HOPWA and housing funding, council also authorized an increase to our funding last year, and in an effort to provide the best quality services to our clients, we really hope that council will maintain this funding at that additional level to our agency again this year. And finally, we also hope that council will increase our share of ending the HIV epidemic funding to our previous 2023 amount as able, but of course, we do understand that there are a number of restrictions, particularly given the situation coming out of Washington. So in addition to these HIV-specific programs, council also authorizes funding for SafePoint, which is a program of Equitas Health to support harm reduction efforts across the city. And as you're likely aware, SafePoint is a comprehensive harm reduction program for people who use drugs, and they seek to reduce the spread of bloodborne infections, prevent deaths from overdose, and increase access to care for this community. And last year, SafePoint actually disposed of nearly 800,000 used syringes in our community, hosted nearly 9,000 visits from their participants, distributed over 20,000 life-saving doses of naloxone, coordinated over 4,400 instances of overdose prevention education, and ultimately saved over 2,500 lives from an overdose. And in the first few years of operation, council authorized periodic increases to SafePoint's funding, but as we spoke to council about last year, for the past several years, the city has continued to flat fund the program at $350,000, despite formally acknowledging the need for an increase at last year's hearing. So given the importance of this life-saving work to the city, we strongly recommend that council authorizes an increase for the upcoming fiscal year, which again, we realize it is a difficult funding environment to ask for this. But we do ultimately hope that this common sense investment will ensure that this vital harm reduction work can continue to grow even more in coming years. And we're happy to provide information from SafePoint's 2024 report. And again, we appreciate the city's continued efforts to end the HIV epidemic. And we're grateful for your continued investment in public health and harm reduction. Thank you so much. And I'm happy to take any questions.
Thank you so much for being here. And then I know, I guess just a quick question too. So I know, related to SafePoint, I know about the county funding. That was a $350,000 grant that was not awarded, that was previously supporting this program. Is that correct?
Yeah, so they have previously had county funding, and I will have to get back to you on the exact numbers, but I'm happy to circle back with that. But yeah, funding is tough everywhere right now. And the biggest way that council can really help with supporting is that funding that's allocated through CPH. Again, that flat funding every year, while it is certainly helpful, $350,000 has significantly less buying power in 2026 than it did in 2021.
Absolutely. I actually think we moved it to $350,000 a year in 2018. I think I was still there.
Yeah, it's been, yeah.
Definitely more
Correct.
expensive than in 2018. Do you have off the top of your head what the total overall cost of the budget is?
I would have to circle back with that, but we do have some of our folks here with us tonight who can speak after the meeting and share some of that. Not to put them on the spot, but we are very happy. I know last year we did have a follow-up conversation following council's recommendation to Columbus Public Health and the health commissioner team. We did have a follow-up conversation where we ran through that all in depth with them. And ultimately, CPH was not able to provide additional funding last year, but we would love the opportunity to dive in a little deeper with the members.
Okay. And then, I'm assuming at this point you're kind of just in the same position as the rest of us. I think there are a few different types of programs that I'm especially trying to remain in tune with, just given the political environment around this work, even though providing healthcare to people, accessing healthcare as any person should not be political. But here we are. Serving primarily the LGBTQIA plus community, incredibly marginalized community, and incredibly, you guys just, your team just does such an incredible job providing gender affirming care, of healthcare in this space that, really didn't exist before you filled this gap in as significant as a way as you do it. And it's just such important work. And so what are you guys looking at for the rest of the continuum of care that you provide for the next year?
Yeah, I think as some of the folks on council know, I spend a fair amount of time in Washington, D.C., working with our esteemed congressional delegation and, really working to make sure that America's healthcare safety net, and particularly the healthcare safety net for folks here in Ohio, is not slashed. We obviously, as folks already discussed, had a huge scare literally less than 24 hours ago.
Did you receive one of the letters as well?
We did not receive one of the letters, thankfully. But, I've been in conversation with folks on Capitol Hill even today, and folks are continuing to have conversations of hearing sort of the rumor mill going about the potential for more letters on other funding sources, particularly as they relate to public health services like HIV and STI prevention and treatment services. Folks are definitely concerned that might, happen. And we might not get lucky like we did this time. But I think, ultimately, we're continuing to work with our congressional partners, our county and state partners as well, to make sure that they understand how important this funding is to everyday people, both here in Columbus, but throughout Ohio and across the country. And, we have unprecedented attacks on America's healthcare safety net. And, we will still continue to do our best to advocate for those services. Yeah.
Awesome.
No worries.
Councilmember Ross, No? Thank you so much for being here. I appreciate
Thank
it.
you all so much for the time to spotlight the great work happening at SafePoint.
Absolutely.
Thank you.
Okay. Our next guests tonight are Carol Argero and Jennifer Sharma from Huckleberry House. Welcome back to council.
Thank you.
Floor is yours.
Good evening. Thank you, Councilmember Green, for the opportunity to provide testimony to this committee this evening. I'm Jennifer Sharma. I'm the CEO of Huckleberry House. On behalf of the young people and the families we serve, thank you. Your support tells our community that their most vulnerable youth, tells the youth that they matter and that the city is willing to show up for them. Huckleberry House's Teen Crisis Program serves youth 12 to 17 years of age who are in crisis or experiencing homelessness. Many of them have experienced trauma, family conflict, or are involved in various systems. Timely intervention literally means the difference between ongoing chronic crisis and stability. And your investment ensures that we can help at the exact moment that the need arises. Because of your direct support through the budget allocation last year, our Teen Crisis Program provided 2,804 nights of shelter to 429 youth. Their average stay was 6.5 days. Not only did they receive a warm bed, hot food, clothing if needed, they were linked to supportive services such as counseling, case management, independent living skills development. And 86% of those youth returned to safe and stable housing. Those outcomes change the trajectory not only of the young person's life, but they're also fiscally important. If we can prevent just one episode of homelessness, we can save our city tens of thousands of dollars per youth per year by deflecting emergency costs and deeper involvement in different systems. Your support is compassion and compassionate, but it's also cost-effective. In today's funding environment, critical services, as we've all said, are increasingly under-resourced, and without continued investment, our ability to meet the needs of youth in crisis is at risk. We recently had a 17-year-old young man come into our crisis program whose father had suddenly died. And so this young man was grieving, he was vulnerable, and he was on the brink of homelessness. He came in, we got him linked with services, we provided him with community resources, and then we helped him get into our transitional living program, where now he has a safe place to call home. He is attending school and he's on track to graduate. That is the work that we do every day to ensure that our youth aren't defined by crisis. They're defined by being supported, moving towards stability and possibility. We're deeply grateful for your trust in Huckleberry House, and we appreciate your current and future support. Thank you. I'm happy to answer any questions.
So the Huckleberry House shelter, that is not under the umbrella of the Community Shelter Board, correct?
Correct.
So how is the program primarily funded?
We have city funding, we have funding from ADAMH, and we have funding from Health and Human Services federally.
Okay. And then I know
And philanthropy.
Okay.
A good chunk of it is philanthropy.
Oh, absolutely. Make
Yeah.
sure to shout out the Huckleberry House donors. Because that is, in fact, what's keeping the program alive. Is that right? I have, well, we'll have more conversations. I mean, I have deep concerns. I mean, I think as our budget rests right now, we would lose the family center if the shelter system is funded at its current level. I know we talked about sustainable funding, not to put your, through maybe July potentially, right? Is that, trying to figure out how to continue providing services beyond that.
Right.
And lose shelter beds in the middle of a housing crisis. It's untenable. And so I don't, as I started out this hearing, right now I have more questions than I don't have all of the answers yet. But what I am going to do is say the truth as I know it, which brings, I think, added attention and accountability, and work as hard as I can to figure out solutions.
Thank you. We appreciate your support.
Yes. Thank you for being here.
Take care.
I'm sorry, Councilmember Ross, did you have no? Okay. We will talk more about that later. And last but certainly not least, we have Amy Klaben here again tonight from Families Flourish. Welcome back to council.
Good evening, Committee Chair Green, and hello and welcome, Committee Member Ross. Looking forward to meeting with you. So thank you so much for having this hearing tonight. I'm Amy Klaben, President, CEO, and co-founder of Families Flourish. Families Flourish is a 3-year program that partners with low-wage working families across central Ohio to help them create their own economic stability and mobility. Today, we serve 96 families, allowing us to serve about 275 people, which includes 160 children. Let me thank you and Mayor's Office personally for the 2025 investment in our work. We would like you to consider another smaller investment in 2026. A recent analysis done by the policy shop Scioto Analysis shows that $1 spent on a child in Families Flourish's program produces $7 in economic gain over the course of his or her life. That means the investment of the City of Columbus made in our program last year will have exponential outcomes. We are an evaluated program with the most recent data from our evaluation team at OSU, showing that the first step to economic mobility is mental health. The toxic stress of living in a violent neighborhood in housing units that are leaky, filled with vermin or lead or mold, is an additional weight on families already struggling to make ends meet. Our program, which currently partners with throughout the region with 25 landlords, provides access to safer neighborhoods where that toxic stress can melt away. 60% of our 96 families live in the City of Columbus, where kids can play outside, and it is after this feeling of safety really sets in, as OSU has noted, is when a parent can start focusing on moving up the workforce ladder. That's when the engagement with our one-on-one coaching and monthly programs really starts to kick in and change lives. 45% of our participants were homeless. We address housing needs for all participants. That's why 65% of our participants are in school or recently completed a program, and 26% are planning on attending a training program or school. Our holistic approach addresses all of their needs so that they and their children are empowered to change for generations. We are in constant assessment of whether our program is truly meeting the needs of families. We always hear from them. And when what they say that we need to make a change, we do adjust. They are the architects of this program as much as myself and our 2 co-founders. And what they do tell us, their first priority still is safety. Once they and their children are safe and in healthy housing, they can spend more time working on themselves, their physical and mental health, careers, parenting, and schooling. One more paragraph. We request that you help us continue to be part of the city's budget at $100,000 in 2026. Funding from the city will be dedicated to rental support for the 60% of participants who live in the City of Columbus. Thank you for your support. Thank you for hosting tonight's hearing, and I'm happy to answer any questions.
I don't have any questions. I just want to thank you for the work that you're doing. You know, I think it's important, you know, for us to be investing funding in our neighborhoods and in people, who, you know, so that they can grow where they currently live and keeping them stable in their current housing. But as a social worker, man, I can't tell you how many times I sat across the table from a mom crying, just if I could just get out of this neighborhood, if I could just start over somewhere, you know, and we've all done it. You know, I've ran from some you know, some problems, moved to a new place and get a fresh start, and people around you to support you. And it's just so important, you know, that we have all of these options for people to access when they need them. So I don't know where we're going to find any of this money in the budget, but I am happy to support your work, and I'm grateful for you for being here and for doing it day in and day out.
Thank you very much. And as you know, we believe in both. Yep. We have to revitalize neighborhoods. That's for the long term. But as you said, what families need today, some do need to have choices in their lives, and we're here to provide opportunities for families to be able to invest in themselves in new ways. And we're watching the impact, which we knew in the beginning would be on the children. It's on the adults too. And I don't have time to tell you all the stories of the adults and the changes they're making in themselves and their own education and careers, which we know will have a multiplying effect on their children.
Absolutely.
And I love hearing the stories of the families where the kids are going back and talking to their cousins, the friends from where they used to live, and making an impact that way. So it's an important new way to have this tool for our community. So thank you for your support.
Thank you for being here.
You're welcome.
Okay. Well, before I close this out, I guess I'll just turn it over to Councilmember Ross, who I know is going to be vice chairing our Housing, Homelessness, and Building Committee, which has so many intersections with the work that we're talking about here today. And then I know as well will be very hands-on with the work that we're doing in the alternate crisis space. So anything you want to say?
So time is well spent, but I will say that the very reason that I'm here is just a ton of the work that we are doing over in the housing space and in the safety space have connections here in the health and human services space. And so as chair, I want to be as supportive as we can be. I know that we are going to be looking for creative ways to partner. We will be in need of creative ways to partner as we move into a budget season that we have not seen in the recent past. And so I want all of you to know that I am here to support. All of you are boots on the ground. And as visionary as we want to be, those visions cannot be executed without the folks who are operating in the organizations that are represented here today. And so in order for us to really move the needle for folks who need it the most, we need to be keeping a very keen eye on how we are supporting all of you. So thank you for all of the hard work that you do every day, the thankless work that you do every day. You are truly saving lives, and we are made all the better by your sacrifice and your commitment to our community.
Thank you so much, Councilmember. Once again, I would just like to thank you all for being here, our directors and city staff and our partners who presented tonight, as well as to my team and bosses who really did all of the hard work of putting this hearing together. Haley Gherkin, John Drury, Jalen Snowden, John Oswald, the brilliant mind behind a lot of our policy work and goals, Director Matt Erickson, as well as for our team with our technology, keeping everything running. The next budget hearing for council will be our economic development and small and minority business hearing hosted by Councilmember Bankston. That's going to be 1 p.m. tomorrow here in council chambers. I will close this hearing out the way that I started it. Right now we have questions and not a lot of answers, but we're going to ask the questions. We're going to ask the tough questions. We have to look at ways to be innovative and creative, ways to stretch our dollars further, ways to reduce our own spending further, so that we can invest more in bridging gaps in our community where it might be needed. And we have to have honest conversations about where we're at with our community financially, and where the rest of the community is at, and help elevate that voice and perspective, because we are, I know, on the verge of a crisis, and we can, bury our head in the sand, or we can face it head on together. And my preference is facing it head on together. And so I think that's who we are as a community. And so looking forward to continuing to partner with all of you and work alongside of you to face these challenges in the future. So with that, our meeting is adjourned. Thank you.